Hey everybody, Two Tip Tuesday, Dr. Bryton here. Today we're going to be talking about fluoride and in particular how it works to improve the strength of your teeth or your overall oral health. So in general, a lot of people have maybe a misconception as to how fluoride works. It does strengthen the tooth, but a lot of people think it's strengthening and they think of muscles, building muscles bigger and bigger and bigger. Fluoride works to strengthen a tooth against a cavity by actually making the tooth harder. Harder in areas where it's become a little bit softer. There's a biological level to it that I'm not going to get into, but ultimately if you can think of like an armor and there's chinks in it and there's areas where it's been weakened by bombardment of decay, it can actually enter into those spaces and essentially take the chain there and establish it again and make it stronger by making it essentially complete and hard through there. And so fluoride works to, yes, strengthen the tooth, but it does so by making it harder. Where it's become soft, it makes it harder. From there, I have a little bit of a diagram here where I'm going to show you ways in which fluoride can actually work to help you. So we got two things here. We have our red areas and then we have our black areas. This outer white area is your enamel, then you have your dentin underneath that, and then you have your nerve through here. First and foremost, if you have decay that enters in and gets into your dentin here, that's a full-blown cavity. There's nothing that we can do to reverse that once it gets into your dentin. However, if we're one of these areas that's just a little black here and we haven't broken through into dentin, fluoride can actually be used to reverse that. We can re-harden enamel via fluoride. That's the power of fluoride. Now again, once you get through here and it gets in and gets into that dentin, there's no reversing. That's a cavity. It needs to be treated, needs to be restored. That needs to be literally cut out of there and restored and filled in. That's what a filling is. However, in these areas, if we can actually get fluoride to them early enough, they can actually re-harden and be stronger again. And so now in addition to that, the fluoride actually has to be utilized a certain way. So there's a couple ways that we like to get fluoride. First and foremost, at home, through a mouth rinse and through your toothpaste. Now, big keys with these are you need to make sure that you're giving enough exposure time. So if you take nothing else from today, remember this. When you brush your teeth, don't rinse with anything afterwards. Don't rinse with water. Don't brush with water. Don't even use your mouth rinse afterwards. Use that beforehand because it helps get in between the teeth, but it's got a little lower percentage of fluoride in it. So we actually want to use it first to get in between the teeth, and then from there get the highest percentage second, and that's in your toothpaste. Or for those of you using it as a prescription gel, we want that to be the last thing that goes on your teeth. And then don't rinse with anything. Don't brush with anything afterwards. Just spit the extra out. Let whatever's left sit on your teeth for at least 30 to 45 minutes because your fluoride needs time to work. It's not an instantaneous thing. It needs time to work. So from there, what I like to go over is essentially a recap on it. First and foremost, it does strengthen the teeth. It does so by making them harder. Secondly, you got to have exposure to it though, and it needs to be 30 to 45 minutes of uninterrupted exposure. Don't eat anything, don't rinse anything, let it sit for 30 to 45 minutes, let it harden there. From there, some of those areas where maybe they're a little bit higher risk, we want to get more to them. So that's where we use things like maybe a prescription gel. You get a little bit higher percentage of fluoride exposure to your teeth, or in addition to that, varnishes at all of your cleanings. Those can be really helpful as well. So fluoride is a wonderful thing, can be really helpful in strengthening your teeth against those cavities, but it does need a little bit of time to soak in and actually do its job. So hopefully this is helpful for you. If you have questions, comment right here on the video. I'd love to respond to you so that everyone else can see it. You can always reach out to us as well, but if that's a little bit more helpful for everybody, just to make a comment that I can respond to it, everyone can see it. But like this, share it, we appreciate it. So hope you have a great rest of your week. Thank you so much.